this is our last one before the end of micro. So I had chapter 15, question 3, which was how is ECE, what it stands for, and how it helps you say no to a patient requesting a prescription for antibiotics. And so first we're going to talk about what it is. It stands for empathy, competence, and education, and you can use this anagram to effectively tell your patients why you won't prescribe antibiotics for a viral infection, because sometimes they'll insist that they know what they need or they have experience that this has helped them in the past, but you can use this to say no without upsetting or embarrassing them. So start with empathy. So you first start with empathy, which allows you and your patient to develop a foundation of trust and ensure him or her that they aren't alone. It is advised to think about what they are going through and share a similar feeling that you've had. But the difference between empathy and sympathy is empathy, I feel your pain, and sympathy, I'm sorry for what you're going through. And so you want to make sure that they feel like you know what their pain feels like. So competence, it allows her to see that you know what you're doing. Getting a patient to trust your competence will reassure him or her of your priorities, of their well-being. Talk them through how you got to the diagnosis and the treatment plan. So it just shows your experience, your knowledge, and then it will kind of put them at ease that you know what's best for them, and so they'll believe you when you say that you don't think it's wise to prescribe antibiotics. And then finally, education. You need to explain why antibiotics won't help them in your situation. So you got to tell them like the potential side effects, and if used unnecessarily, your body can like become resistant to them, and so they won't work when you need them to. And patient education is really important, especially now when the internet is so. When people are so involved with Google and medicine dictionary, and so they feel like they know what you're supposed to do, but this allows them to understand why you're not going to give them what they're asking for. And then you close with letting them know if their symptoms change, just to give them a call and you can change the care plan. And then that reassures them that if anything does go wrong, that you are open to the idea of them coming back and you prescribing them something else. And then that's my works cited. And thank y'all for watching.